my name is Dr. Heidi Klessig, and I am a retired anesthesiologist and pain management specialist. And last year, I published this book. And when I first met Julie Grimstad over the phone, I told her, you know, if I would have known about HALO, I would never have gone to all this trouble. HALO is doing a wonderful job covering the issue of brain death and transplant, and I'm so glad to be able to co-labor with them. So thank you so very much to all the people who work so hard at HALO. Our book, as you see the title there on the slide, Harvesting Organs and Cherishing Life, What Christians Need to Know About Organ Donation and Procurement. And people have asked me, you know, Dr. Klessig, you know, why didn't you just write a book about science? Why from a Christian perspective? And I'm here to tell you, I love science. Science is so necessary and so important to tell us about the world God gave us. And I love discovering new things all the time in science. But science does not operate in a vacuum. Science does not tell us right from wrong. So we need an ethical framework to interpret what science can and cannot do for us, and maybe what science should and should not do for us. I wrote this book with my incredible co-author, Christopher Bagash, who not only is a registered nurse, but he also has a theology degree and has worked in the pastorate, and he has authored many books on the intersection of faith and medicine, which you can find on our website, which I'll introduce to you later, or on Amazon, and I would certainly recommend all of those to you as well. Today I'm going to give you a lot of information. And, you know, if you haven't thought about this topic much before, it's going to be overwhelming. It's a lot to take in. So what I would recommend, if that's you, is that you just sit back, listen to the talk, watch the slides. At the end, I'm going to connect you up to our website, which has all the information that you want. In fact, our IT person just tells me that she put the PDF of every single one of my slides on our website, so you don't have to photograph the slides if you don't want to. You don't even have to take notes if you're a note taker, and I can't hardly think without a pencil in my hand, so that might be you too. So just take it all in. On the book, what I like about the book, I mean, I love talking to you, I love the website, giving information. The difference, I think, in the book is the book has the stories. The book has the people in it. It brings it down to a much more human level. And so if you want to pursue that a little further, I do recommend the book as well. All right, here we go. This is going to be a rapid fire. So our message in the book is that we want to be pro-life to the end of life. My co-author and I have met many wonderful people who are passionate about protecting and cherishing life in the womb. But we find that many people in the church just don't know about the plight of the poor organ donor at the end of life. And how do we protect and cherish those people as well? So that's why we wrote the book. So you would not be surprised, I'm assuming since you're here, that you're aware that this is a person, right? This is a tiny little person being depicted in the diagrams. A fertilized egg divides into 2 cells, into 4 cells, 8 going on from there to become a baby, a toddler, a teenager, a middle-aged person, senior citizen, and we protect and cherish life throughout that process. Now, this is also a person, and you may say to me, well, Dr. Klessig, of course that's a person. Look at him. He's laying there. He's got color. He appears to be warm. He's got monitors. We can see he's breathing. He's got a heart rate. He's got a blood pressure. He's got all kinds of confusing tubes and drips and medications going. Well, of course this is a person. Would it surprise you to know that there are people who look exactly like this in ICUs around the country and the world right now today, whose doctors have declared that they are legally dead while their heart is beating, while they're breathing, with a ventilator, sure, but these people can be declared legally dead, and a doctor might approach you and ask you permission to harvest this person's organs. What on earth is going on with that, right? Well, I'm going to tell you more about that. I'm going to introduce some terms. One of the things that will make this easier to understand is we're going to make a distinction between what doctors call organs and what doctors call tissues, okay? So I think you all have a pretty good idea of what an organ is, something like a heart, a lung, a liver, a kidney. Organs are very dependent on a continuous supply of oxygen and nutrition through the bloodstream. Take that circulatory system away, and they very rapidly become non-viable, begin to decompose, and become unsuitable for transplantation. Tissues, on the other hand, and when a doctor says tissues, I don't mean puffs, I don't mean Kleenex, I mean things like skin, bone, the corneas in our eyes, fat. These things are very much more resilient in the absence of blood flow. And so a biologically dead donor can be an excellent way to donate tissues because they don't break down. A biologically dead donor, however, cannot donate an organ. And I'm going to keep coming back to that because, you know, we need to kind of keep those areas separate in our thinking. I'll kind of bring this point forward to you, the fact that organ donors must be alive with beating hearts, breathing lungs for a viable organ donation by asking you, a lot of people die every year. Why should there be an organ donor waiting list? If dead people can give organs, there should be plenty, right? So we looked at some numbers. In the United States in 2021, this is all 2021 last year's data, about 3.5 million people died. On the other hand, there were about 106,000 people on the transplant waiting list. If dead people could donate an organ, you would think we'd have way more than we need, right? But that's not the case. But you might say to me, well, Dr. Klessig, not everyone is a registered organ donor. And you would be right about that. So according to Health and Human Services in the United States right now, as of last year, there were about 160 million registered organ donors. And if we would multiply that by the mortality rate last year, we would statistically expect, doing the math, about 1.5 million registered organ donors died. Now remember, there are 106,000 people waiting for an organ. If you could take an organ from a dead person, we still would have an enormous surplus. The United Network for Organ Sharing states that in 2021, only 13,000, almost 14,000 people became deceased organ donors. Now, remember, 1.5 million registered organ donors died in 2021. What is so different? What is so special about this 13,000 that they get to donate their organs and other people don't? Well, according to organdonor.gov, only 3 in 1,000 people die in a way that allows for deceased organ donation. Okay, well, what is this special way of dying? I mean, 1,000 people die, only 3 can donate their organs? What's going on with that? Well, I'll tell you. The definition of death was changed in 1968. You know, up until 1968, I think all of our ancestors had a pretty good idea of what was dead and what was alive, okay? When you became cold, gray, and stiff, you were dead, right? Otherwise, you were alive. But in 1968, some doctors at the Harvard Medical School decided that they were going to redefine irreversible coma as a new criterion for being dead. They did this for a number of reasons, but one of the biggest reasons was to free up a supply of organ donors, because people in an irreversible coma have beating hearts, they have breathing lungs, their organs are well perfused and suitable for transplant. The ad hoc committee from Harvard Medical School's recommendations to redefine irreversible coma as death were codified into law in the United States in 1981 with an act called the Uniform Determination of Death Act, or the UDDA. And I'll tell you what the UDDA has defined death as. Number 1, either the irreversible cessation of circulatory and respiratory functions, or number 2, the irreversible cessation of all the functions of the entire brain, including the brain stem. Now, that doesn't sound too unreasonable on the face of it, but the devil is in the details, and that's why on the slide you see I've highlighted in italics the word irreversible. Just how irreversible is this? The UDDA has been very controversial since its inception. 3 presidential councils have been appointed to study it, both before and after its passage into law. In fact, there was a movement even last year to redefine and recodify what the UDDA says that was sort of tussled back and forth in the medical community. I'm going to kind of highlight that second part of the slide with the stethoscope. In 2018, Harvard Medical School, remember Harvard Medical School was the place that started all the problem with redefining coma as death, they decided to hold a bioethics conference. They called it Defining Death, Organ Transplantation, and the 50-Year Legacy of the Harvard Report on Brain Death. I'm going to show you some of their findings. Here's a quote from the 2018 Harvard conference. The UDDA is best used as a legal instrument to represent death in the United States, not as a way to describe death as a biological occurrence. So the UDDA allows people to be declared legally dead while they are biologically and spiritually still alive. That's pretty terrifying, isn't it? Here's another quote from the conference. This is a lengthier quote, but I'm going to go through it because I think you'd like to know. This is from David Rodriguez Arias. He's a researcher in moral philosophy and bioethics. Policy making becomes indoctrination whenever public opinions and preferences are intentionally manipulated in ways that destroy or prevent citizens' independent judgment and rational deliberation. The history of death determination in the context of organ donation can be described as an indoctrinating attempt to settle a moral controversy. So next time you're at the Department of Motor Vehicles and you're renewing your driver's license and you see those posters encouraging you to become an organ donor and sign that donor card, I want you to remember an indoctrinating attempt to settle a moral controversy. This UDDA is widely discussed in the medical community, but the people I've talked to in the public never hear about it. And that's why I'm here to tell you. This book was written by some of the doctors who were at the 50-year conference, Drs. Miller and Truog. They would like to be more honest. They think it would be more reasonable to tell the public that these patients are not dead. But on the other hand, they really want those organs. So their solution to this sticky wicket is to change our system of ethics at the end of life so we can harvest organs from these people anyway. Now I'm going to move into the second section of the talk. There are different kinds of donations, and I was just talking to a member of the audience a minute ago, and I want to convey not all transplants are bad. Many transplants are wonderful, ethical, laudable. You should consider them, and I'm going to highlight those in a very positive way and to make a clear distinction between those and the ones that are problematic and the ones that we should speak out about and avoid ourselves. So the first one that I'm going to talk about is living donation. Living donation is the happy story of transplant. In living donation, everyone stays alive after the procedure. So the donor stays alive, the recipient stays alive. This is a wonderful story. Most people think of living related donation because people who are related in the same family share very similar genetics, and they can more readily transfer an organ from one family member to another. But it doesn't have to be a related situation. I'm going to show you these gals. These are a couple of ladies who worked in a healthcare center in the Atlanta, Georgia area. It turned out each of them had a husband with renal failure needing a kidney transplant. And of course, the wives wanted to transplant their own kidney to their husbands, but neither one was a match. But it turned out that each was a match for the other one's husband. So here we were in March 2021, each donated a kidney that was successfully placed in the other spouse. Here's 4 very happy people and their families and their loved ones. This is a wonderful thing. So living voluntary donation, you may have been involved with this without really thinking about it. If you've been a blood donor, you can donate blood, you can donate bone marrow, you can donate skin. If you deliver a baby, that placenta can be donated for healthy stem cells. You can donate one of a pair of organs, such as a kidney. We have a lady in our community that successfully donated a kidney to her daughter. You can give a part of a lobed organ, such as a liver. Now, I'm told those haven't worked out quite as well as was hoped, so they're not done as often anymore, but that is something that has been done. So again, living voluntary donation, I mean, in addition to the fact that this is a wonderful example of selfless service, these donations actually tend to be more successful and long-lasting. This is because, as in the case of our people in our community, they had the mother in one operating room, and right next door they had the daughter. And they were able to take that kidney, the mom says, they carried it like a baby right over to her daughter, and they put it right in. And there was a very short interval of that kidney not being connected to somebody's blood flow. So that kidney stayed very healthy, and that young daughter has had that kidney over 20 years now. So the living related and the living donations do tend to be more long-lasting and successful. Downside, if there is a downside, I guess, with living donation, there are certain organs that you just can't give away, right? So we cannot do a living donation of a heart transplant because we can't take it out of me and have me still alive to give it to you. But for paired organs, for many things, this is a wonderful thing to do. So we're going to move on to the next one. I'm calling this one morgue donation, and I'm using that term to make it perfectly clear to all of us that these people are all dead. These people are gray, cold, stiff, right? These people are biologically, spiritually dead. Their spirit has departed back to the Lord who gave it. These people are not able to donate their organs, but they can donate what I described to you earlier as tissues. Things like their corneas, skin, bones, heart valves. I talked to David earlier. He received a piece of dura mater, one of the linings around the brain, from a lady over 20 years ago. Is that right, David? I don't know where David went just now, but okay, yes. How many years ago?
29 years.
29 years ago. And he does not need to take any anti-rejection drugs. What a wonderful gift. I mean, this is a wonderful thing that you can do for somebody. And again, because these people are biologically dead, they can give tissues, but they cannot donate whole organs, which have already become necrotic due to lack of blood flow. Now, when my co-author and I researched this book, we had no idea that there could ever be any problems with this. What could go wrong with harvesting some tissues from a biologically dead donor? Well, we found this article from the LA Times. In the rush to harvest body parts, death investigations have been upended. The reporter, Melody Peterson, found over 24 instances in the state of California where the company that harvests the tissue from the corpses had first run at the deceased person before the coroner or medical examiner could take a look at the body. This is a problem because often this left the coroner unable to tell the family why their loved one died. They could no longer determine a cause of death because the amount of, I have to say destruction that takes place when you remove all these tissues from someone's body for harvest. In some of these cases, the death was possibly the result of a crime. And because the coroner could no longer make a determination, justice was not served. So this left some very devastating families. It's quite an interesting article to read, and it is linked on our website if you want to follow up the original article. But I'm going to give you a couple examples. This is John Flath. We mentioned him in our book. You can see John is a healthy young man. He's an athlete. He works out with ROTC. Well, when he was 18 years old, back in 2011, he was working out with the cadets in the Air Force ROTC program, and he just sat down and died, suddenly, unexpectedly, an 18-year-old, right? But because, this teenager had signed his donor card on his driver's license, the family could not stop the harvesting team from procuring his tissues before the coroner had a chance to look at him. And sadly, the procurement team took John's heart valves to be sold as medical devices. So by the time the LA County coroner took a look at his heart, it had been so destroyed that he really could not tell the family why John had died. That's heartbreaking for a mom. I know it would be. This is Christy Rettenmund, and if any of you are Major League Baseball fans, her father is Merv Rettenmund. He was a Major League Baseball player and coach, I'm told. Christy died in 2013 after suffering apparent violence. She was brought to the hospital looking pretty beat up. It turns out her boyfriend had previous arrests for domestic abuse and violence, but because she had signed an organ donor card, her organs were removed prior to the official autopsy. And because of this, the pathologist was unable to determine, when he got to do the autopsy, whether her injuries were caused by a crime. So her family had no closure. There was no justice done. So there are some caveats with this. In general, I want to emphasize a biologically dead body would be a fine thing to do, but be sure all the questions are answered before you submit yourself to that. But you might ask yourself, why are the harvesting companies in such a hurry? Why? Well, as they say, you want to follow the money, right? This is a graphic from the LA Times article. I think you can read it. I'll highlight just a couple. If you are going to donate skin from a biologically dead body, for a piece of skin about the size of a piece of typing paper, you're going to get about $16,500 for that. Some of you may have had spinal fusion surgery, and one of the things they use in that is bone graft. And again, that's an ethical thing to do. The bone graft generally does come from a biologically dead body. For a teaspoon of ground bone mixed with stem cells for back surgery, $2,550 for a teaspoon. This is the body you gave away for free, remember, okay? Doesn't seem to add up to me. But again, this is a biologically dead body. Now, if we were talking a person in a coma defined as dead that could actually donate organs, heart, lung, liver, kidneys, an intact human body can be worth over $5 million. So this is big business. And big business, I'm sorry to say, is sometimes what drives a lot of this. All right, the next two are human rights abuses, plain and simple. And they happen mostly overseas. I'm going to just let you know about them so that you're familiar. The first one is forced organ harvest. This takes place pretty much in communist China is where this is happening. Forced organ harvesting is the execution of a prisoner via the harvesting of his or her organs. This is happening right now in communist China, where political dissidents and religious minorities, if you've ever heard of the Falun Gong, is a religious movement. It's a peace movement. It's a meditation sort of religious movement. They are very much targeted for their organs by the communist Chinese government. The Uyghur Muslim community is very much targeted because wealthy organ recipients from the Saudi companies see that their organs are uncontaminated by pork or alcohol. So these are a very lucrative business as well for organ harvesting for Muslim people. And house church Christians, all of these are forced to undergo blood and tissue typing as part of their arrest. Their organs are then put on the market for transplant tourists who come to China from all over the world to have their transplant surgery on the day the prisoner is executed. The graphic on this slide is from a documentary film by Leon Lee called Human Harvest, and you can rent it or buy it on Amazon to view. I think it's on Vimeo. It's hard to watch, I won't kid you. It's hard to watch, but it's the kind of thing that people should know about and speak out about. Sadly, the United States still permits insurance companies to pay for Chinese organ harvesting. Other countries, this has been banned. I did hear the story of how this happened in Israel. In Israel, a patient came to his doctor saying, I need a pre-op physical. I'm going to China. I've got an organ transplant scheduled. And the doctor said, how does that work? You can't schedule a transplant. How do you know that a donor that matches you will be available the day you come? Well, in China, they do, because the prisoner will be executed on the day your transplant is scheduled. So because of that, that doctor in Israel did get this before their legislature. And so Israel, Spain, Italy, Taiwan, Norway, and Belgium have banned this practice. This is Dr. Thomas Dyflo. He is a transplant surgeon in New York State. In the early 2000s, he began seeing patients who wanted follow-up care from him who had received an organ in China. And as he questioned people about that, he was sort of surprised that they were very upfront about the fact their organ had come from an executed prisoner. And he was stunned that they really, a lot of them didn't seem to care. So he took this before his local medical board, state board. He's even testified before Congress about this. Unfortunately, so far, nothing has changed. But I don't want you to give up hope, because these people have not given up hope. This is from an Epoch Times article that just came out earlier this month. It's showing a march by Falun Gong practitioners in Flushing, New York, April 23rd, 2022. This is the 23rd anniversary for them of this march. They are not giving up, trying to shine the light on this practice and make change. So good for them. And now we can join our voices to theirs. The next one I'm going to talk about, again, another human rights abuse. This is organ trafficking. Organ trafficking is a wealthy recipient taking advantage of an impoverished person by paying them some paltry sum to donate an organ. It's a way to get right to the top of the list, right? You get your organ now. But it is through the exploitation of the poor, which is something that nobody should condone. This is an article from The Guardian, January 23rd, 2022. I've already sold my daughters, now my kidney. This is from Afghanistan. This often is happening in places far away, places like Pakistan and whatnot. Even though the exchange of organs for money is illegal, it's only legal in Iran. I don't know why Iran makes this legal, but it is legal to sell your organ in Iran. Everywhere else not. Even though the exchange of organs for money is illegal, the World Health Organization estimated in 2009 that 1/5, that's 20%, of the 70,000 kidney transplants worldwide that year came from organ trafficking. This is really happening. Now, you might say we live in a capitalist country. What's wrong with selling your organs, right? The problem is these poor people are having major surgery, and they're getting their money, and then that's all they get. And I'm here to tell you, complications can happen from major surgery. The lady in our community who donated a kidney to her daughter had major complications, and they took time and money and hospitalization to make her better. I don't think these people in Afghanistan are getting that kind of follow-up care. So I think it is exploitation, and I think we need to be against this. The Declaration of Istanbul has addressed this. This is a declaration that came out against transplant tourism, trafficking, commercialism. It was signed by just about every transplant organization that can sign these things, which it is wonderful. They're shining light on it, but it has no enforcement arm. There's no teeth in this. We all do agree it's bad, and it's good to shine the light on it. I wish I could say that organ trafficking does not happen in the United States, but I'm afraid it does. There are black market organ traffickers that will even work with people in the United States, find a poor person that needs the money, and they'll show up with you, carefully scripted, at the hospital saying they want to give you a living donation because you're their best friend. And the hospitals don't always look too closely into the background or into the story, so this will happen here in the United States as well, I'm afraid. Okay, now, donation after brain death. This is the hardest part of the talk for me, so I ask that you bear with me on this because this one's emotional and personal for me. When I was in my anesthesia training at the University of Wisconsin Hospitals in Madison, Wisconsin, one day on night call I was asked to go up and prepare a young man for an organ donation. And I came up to the ICU and I saw a young man that looked a lot like this. He was warm, he was pink, he'd had a motorcycle accident and had a head injury. He was about my age. His monitor showed he had a beating heart. He was breathing, with help of a ventilator. And they told me this man was dead. And I was being trained to think like a doctor, and I believed what they told me. So I never stopped to consider, where is his immortal soul right now? Am I to suppose because he's been declared brain dead that his immortal soul somehow has already departed and is in heaven with the Lord? I didn't think for myself. I accepted what my authorities told me. So I took a warm, heart-beating, living person, and I took him down to the operating room, and I held him down with anesthetic drugs while they took out his heart and lungs and liver and killed him. And this is something that I can only tell you fills me with shame and regret at this point. And if there wasn't a forgiving Lord who loves us and offers us forgiveness through Jesus Christ, I could not stand before you today. But this is why I'm here, because when I realized what I had done, I can't tell you how awful that made me feel. And I don't want any of you to ever have to feel like that. So that's why I'm here speaking to you tonight. And that's why I have a book, and that's why I have a website. And this is something that I will carry with me for the rest of my life. So what is this brain death diagnosis? How is it done? How is it made? It might surprise you to know, now you all look pretty good right now, but I could do a brain death assessment right here in the room with just very common household items. There is no requirement for an MRI, an EEG. The EEG test requirement was removed back in 1971. I mean, you can do these tests, but they are not required for a diagnosis of brain death. The standard exam, I would come to you and I would give you a painful stimulus. I'd rub my knuckles on your breastbone, or I'd pinch your nail bed, and I would see if there was a response to pain. I would brush your eye with a cotton swab to see if it made you blink. I would turn your head to see how your eyes swiveled as I turned your head. I would inject some cold water into your ears to see if it made your eyes dizzy. And I would disconnect your ventilator and see if you would breathe on your own. If you fail all those tests, then doctors say your brainstem's not working, and they conclude that then probably the rest of your brain isn't working either. But do you see a brain here? I don't. Do we have to have a brain to be human, to be a person, to be worthy of cherishing, protecting, and loving? Absolutely not. It doesn't matter if we have a brain. If we have a brain that's not working very well. A person, the teaching of the church is a person is a body-soul unity from conception until our final breath, until our spirit departs to be with the Lord. Can you tell I'm getting mad? I'm sorry. Maybe you're getting mad now too, right? All right, just wait. It gets worse. Okay, this is Zach Dunlap. Zach, as you can see here, is alive and well, but at one time he wasn't. In 2007, Zach Dunlap suffered a head injury after a four-wheel ATV accident, and he was pronounced brain dead according to the UDDA criteria. But you know, Zach was a young man. They wanted to go the extra mile, so they actually did further testing. They did what's called a cerebral perfusion scan to see, does Zach have blood flow to his brain? And the radiologist report came back, nope. No blood flow to Zach's brain. So his parents were approached, and a discussion was had as to whether or not they wanted to donate Zach's organs because he was brain dead. And his parents said, you know, okay, we'll go ahead with that. All right. What did Zach think about that, do you think? Well, I can tell you. In a 2019 interview, this is what Zach said. The next thing I remember was laying in the hospital bed, not being able to move, breathe, couldn't do anything, on a ventilator. I heard someone say, I'm sorry, he's brain dead, he's passing away. And there's nothing I could do, just get mad. I couldn't do anything to sign at all. I tried to scream, tried to move, just got extremely angry. Can you imagine the horror of lying there listening to your parents discuss this with the doctors, not being able to do anything? Well, thankfully, Zach had a cousin who was a registered nurse, and his cousin didn't really believe Zach was dead. So Zach came into the bedside and did his own neurologic exam. He took his closed clasp knife and just pinched down on Zach's nail bed. And praise the Lord, Zach withdrew his hand. Okay, now they've got someone's attention that they're actually going to start taking care of this young man. And he made a full recovery. I mean, you can see in the picture, he's got a little scar from where his tracheostomy tube was. But he's alive and well and raising a family somewhere in Nebraska, I think. Okay, how irreversible is this? The UDDA says irreversible. I shudder to think how many people, are lying there, and it could be reversible if you maybe waited a little longer, if you don't happen to have a cousin like Zach who's going to push the issue. Yeah. This is Dr. Alan Schumann. He's a retired pediatric neurologist from UCLA Medical School. He speaks out against this brain death donation all the time. He has documented 175 cases of brain dead people who lived after the declaration of death under the UDDA, some for more than 20 years. Some of these people went through puberty. Their bodies grew and developed. Some of these people delivered a healthy baby after being declared brain dead. How dead is that? Not at all. Dr. Schumann says that after a brain injury happens to us, the brain enters kind of a shock-like state. And so if you test during that state, you're not going to get much response. But if given enough time, often the brain can make an amazing recovery. Troublingly, he says too, patients are often declared brain dead and sent to be harvested before this recovery can occur. Dr. Sam Parnia is a resuscitation specialist, and he says that if you have a cold injury, if you're fall into cold water, it can take up to 7 days for that brain to kind of recalibrate and wake up again. How many people are declared brain dead and just if their doctors would have waited a little longer, would have had a chance? All right, this is kind of a Dr. Alan Schumann's coup de grace, we'll say. Just as cigarette ads are required to contain a footnote warning of health risks, ads promoting organ donation should contain a footnote along these lines. Warning: it remains controversial whether you will actually be dead at the time of the removal of your organs. All right, I'm going to move on to the last one on the list, donation after circulatory death. Now, when I was in training, it was pretty much only brain dead organ donations that were going on. This had not really come up, but in the 90s, a new donor pool, we're always looking for more organs, a new donor pool was discovered. These patients are not brain dead, but they're very ill, and in fact, they're not expected to survive. So, a lot of times it's not unreasonable, if grandpa is ill and there's, it's the end of his life, I don't think there's anything wrong with letting grandpa go to heaven. You can certainly withdraw care in a merciful and compassionate way. But instead of withdrawing care in a merciful and compassionate way, they're thinking, we've got those organs sitting there. Why don't we withdraw care in such a way that we can take the organs? So how do they do this? Well, the patient is taken to the operating room or a room nearby. The transplant team is scrubbed and ready to go as soon as possible because, again, those organs, once the blood flow stops, they start to break down and you need to get them right away. Medical support is withdrawn. The patient is monitored until their heart stops beating. And then it's kind of a 2 to 5 minute wait. There's no standard. It's 2 minutes in Wisconsin. It's 5 minutes in Canada. They waited a whole 75 seconds for a baby in Denver. And after that, if your heart hasn't spontaneously restart, they declare you dead and take you to the operating room for harvesting. But the question is 2 to 5 minutes really enough time to be sure they're not dead? And I'll tell you, this is why many medical professionals are uncomfortable with donation after circulatory death, because we know for sure that many people, after only 2 to 5 minutes of cardiac arrest, are routinely resuscitated, okay? So again, if one of you, God forbid, would have a cardiac arrest right now, I'm here to tell you it would take us at least 2 minutes, okay? We'd have to get you out of your chair, put you into the aisle. We'd have to start CPR. We'd have to remove your clothing. Does anybody know if there's a defibrillator in the building? If there is, someone has to go and get it. We have to bring it in. We have to open up these patches. If you're a real big burly guy, we have to shave the hair off your chest to make those patches stick to you. Then the machine has to warm up. It has to go ahead and deliver the shocks. It's going to be at least 2 minutes, at the very minimum, if not more, for us to actually get your heart restarted. But you know what? If we can do all that, and we jumpstart your heart, and we get the ambulance here, and they take you to the hospital and fix the underlying problem, you have an excellent chance of walking out of the hospital and doing just fine. So I'm here to tell you, doctors and nurses are uncomfortable with this donation after cardiac death because we know people are very readily resuscitatable in that 2 to 5 minutes. I don't think the spirit has departed from the person at that time. Some of you know Alex Schadenberg from the Euthanasia Prevention Coalition. I want to thank him for pointing this out to us. This is a case report from our neighboring state of Illinois. It says, pronounced dead twice. What should an attending physician do in between? I'll tell you, this is a sad story. This is a 39-year-old woman with Down syndrome who very tragically had a brain aneurysm burst in her brain. And so she was brought to the hospital, and she wasn't brain dead, but she was not expected to survive. So her family was approached, and they asked, as long as you're going to be withdrawing care from her anyway, could we do this in the operating room and harvest her organs? And her family gave consent. So there's a lot of words. Whoops, wrong button, sorry. There's a lot of words on this slide. I'll kind of sum up for you here what happened to her. So she was taken to the operating room, and the ventilator was disconnected, and her heart did stop. The doctor reached up under the sterile drape. This is also horrifying to me that this woman had to die alone in the operating room surrounded by strangers, okay? Where's her family that should be around her at this time? But I digress. So the doctor reached up under the drapes and listened and didn't hear her heart beating, and they timed 2 minutes. They declared her dead, right? And at 2:59 a.m., she's declared dead. Organ procurement began at 3 a.m. As they did their big incision and came down into the internal organs of the abdominal cavity, they noticed that there were pulses in the aorta and in the renal arteries. Her heart had restarted. And shortly after that, she began to gasp for breath. Well, now what do you do? This is a horrible situation. Out of mercy, they gave her additional doses of fentanyl for pain and lorazepam to blunt consciousness. And she stopped breathing again. The coroner took a look at this case. She was pronounced dead a second time at 3:17 a.m. The coroner had to say the cause of death is homicide. They killed that woman. Now, I'm surprised that this got reported. I would suspect this happens more often than you might know, and it usually would not get reported. But this one did get reported. Okay, so if it, you didn't think it could get any more gruesome, but it can. If the donor's heart is to be harvested after circulatory death, the circulation to the brain is clamped off, and then that heart really needs a lot of oxygen. The heart and other organs are reoxygenated and restarted to be sure they're viable for transplant. So I put this slide in, a lot of it's in, this one's in here for me because I can hardly even believe they do this. So I'll kind of highlight this because this is one of those wordy medical protocol thingies. This is the protocol for donation after cardiac death of a heart from the University of Nebraska. So number 1, we're going to open the chest through a standard sternotomy incision. Number 2, we're going to ligate all the blood vessels that supply blood to the brain. Ligate means tie off. Okay, so we're going to tie off the blood vessels to your brain. Number 4 down there says we're going to initiate cardiopulmonary bypass, which will reestablish flow of blood to all the organs of the body, except for the brain, right? Because if we resuscitated that, you'd wake up. But they don't really want you to wake up. They want the heart to be good. So they resuscitate the heart after they've clamped out the circulation to your brain. The next sentence on this protocol we've highlighted in red for you now. Once blood flow to the heart is established, the heart will start beating. Okay, do you remember the UDDA requirement? Irreversible cessation of circulatory and respiratory function? How irreversible is this if we can restart your heart in your chest cavity? I contend this is not irreversible. I think this is not according to the letter or the spirit of the law, but it's happening all the time. Okay, we're getting there. Just hang in there with me. I'm going to let Dr. Ari Jaffe close this section for us. Dr. Ari Jaffe, I just would love to meet him. Look at him. Doesn't he look like he looks like a guy that you could talk to. He's a pediatrician and critical care specialist at the University of Alberta in Canada. Here's what he says. I have argued that brain death is not death itself. It leads to death when and only when ventilation is stopped and therefore breathing stops, followed by cardiac arrest, followed by irreversible loss of circulation. This is death. Further, I believe that at 2 to 10 minutes after loss of circulation, the DCD, donation after circulatory death, donor is not dead. This is because there is not necessarily irreversible loss of circulation. That is to say, the loss of circulation could still be reversed. When exactly this state of irreversibility occurs is an important question. At present, this is not known. However, it is known that it is not even 10 minutes after cardiac arrest. He knows this because he's done a case survey and has found people who their heart stopped for 10 minutes, they were not given medical intervention, and their heart spontaneously restarted. 10 minutes. And some of them made a complete recovery. So he knows that 10 minutes isn't enough because he's found cases of it. Whether I'm challenging the practice of organ donation is another question. The question is not whether organ donors are dead, because they are not. The question is whether organs can be harvested before death from patients whose prognosis is death, and hence be a contributing cause of death. My argument is that this is the current practice, and this is also precisely what needs to be debated urgently. Is organ harvesting before death violating respect for persons and using them as means? I think we would say yes. We'd have to agree. Okay, that was the heavy part of the talk. Now we're going to look at this cute little pig. I just need this slide at this point. I like to look at the sunlight coming through those cute little ears. Whew. All right, I'm going to tell you just a little bit about xenotransplantation, that is taking an organ from a non-human species. I'm going to give you I have to tell you a little something about anesthesia because I'm a recovering anesthesiologist after all, right? Okay, so we'll do those and then we'll do our action points. So xenotransplantation, actually this historically was some of the first transplants. And back in 1906, doctors actually took pig and goat kidneys and tried to put them in their renal failure patients, and they didn't know anything then because of course they were not compatible and the patients sadly did die. But you may have seen in the news just this February, I believe, an American patient became the first to receive a genetically modified pig heart transplant. What they had done is they had taken the donor pig and they had deleted certain of the pig genes and they had inserted some of the human genes to make the organ less likely to be rejected. And at first, the first reports, the doctors were so excited. It seemed to be going very, very well. But sadly, David Bennett Sr. was his name. He did pass away due to complications from a pig virus. Okay, so the porcine cytomegalovirus hitched a ride on that donor heart, and him being immunosuppressed, he was not able to fight that infection, and he did die of that. So there are many ethical questions about xenotransplantation that I'm not going to take time to do right now, but if you're interested, we can go into that more in the Q&A. Right now, does not seem like this new technology is working so far, though I'm sure people will continue to look into it. All right, because I'm an anesthesiologist by training, I wanted to know, will I receive an anesthetic when I donate my organs after, so-called death, right? Remember, the UDDA allows people to be declared legally dead while they are biologically and spiritually still alive. Now, if you are legally dead, you have no right to autonomy or self-determination. The medical system changes from serving your best interests to serving the best interests of those who will receive your organs. So I reviewed a lot of the anesthesia literature, and I just bring this up as a representative article. They're all pretty much like this. This was published in the Canadian Journal of Anesthesia in 2015. It's entitled Anesthetic Considerations in Organ Procurement Surgery, a Narrative Review. So this article reviews blood pressure management, fluid management, how to protect the lungs while we ventilate you. Again, focused on the organs, you might note. Endocrine, which would be hormonal therapy, transfusion to maintain optimal oxygen delivery to the organs. Okay, all of this is very organ-focused. They do say that you should give neuromuscular blockers, that's paralyzing drugs, to prevent movement during surgery. Would it surprise you to know that dead people move during surgery? That's very upsetting to the operating room staff. So they recommend you paralyze these people so as not to upset everybody. Interestingly enough, this article does not mention any actual anesthesia. They don't say anything about giving pain-relieving drugs. They don't say anything about giving consciousness-blocking drugs. This is very, very par for the course. These doctors, again, we mentioned this book earlier, these doctors that were at the 50-year Harvard conference reviewed the European anesthesia literature debate about whether brain-dead donors should be given an anesthetic. They found two responses. First, the first one, and I'm very thankful that in my training this is what I was told, as sad as I am that I allowed that man to be, that man that deserved my protection, okay, I am culpable for that. I should have been protecting him. But thankfully, I was told to give him an anesthetic. At least I have that. That would be the first view. Since brain-dead patients retain some brain functions, we cannot be sure that they don't feel pain during the harvest. After all, blood pressure and heart rate do increase with incision on these people. I'm here to tell you that it does. Therefore, an anesthetic should be given to be on the safe side. All right, this is a direct quote from the book then. Others disagreed. Surprisingly, their position was not based on the claim that the patients were incapable of experiencing pain. Instead, they were concerned that if the public learned that anesthesiologists were giving an anesthetic to dead patients, it would make them suspicious that the patients were not really dead. Well, that's terrifying. I mean, you are at the mercy of, flip a coin. Which anesthesia is on duty today, right? I cannot guarantee any of you that this will be given if you become an organ donor. Okay, I'm going to finish up with our action points. Again, just to remind us, if we are truly pro-life, we need to cherish and protect life from conception until natural death, when the spirit departs to the Lord who gave it. I want to remind you, organ donors, we're talking about the organs now, are biologically and spiritually still alive. And even if the law has taken away their rights by declaring them legally dead, we can and must fight for them. How can we do this? We recommend that you refuse to be a registered organ donor, okay? That doesn't mean you can't be an organ donor, but I would not register as one, and this is why. Registering as an organ donor means that your organs will be taken, regardless of your living will or the desires of your surviving family. This leaves you helpless against being harvested while biologically still alive, like Zach Dunlap, like John Flath, like Christy Rettenman, right? But removing your consent from your driver's license does not guarantee that you will be removed from your state's organ donor registry, particularly if you've previously registered as an organ donor. They may not pass on that information. So just because your card here says you're no longer an organ donor, your name could be on file with your organ donor registry. So Halo has addressed this problem with this wonderful wallet card. You can download this from their website. Ayan, I don't know if you found some to have on the, yep, Ann has some on the back table today. So you can, if you're concerned that you might be on an organ donor registry somewhere, you can put this in your wallet. It says, I refuse to be an organ donor. Do not perform an apnea test. Do not notify an organ procurement organization if I appear to be at or near death. Do not take any organs for transplantation or research. I think this would be a helpful thing to protect yourselves. And the other thing I want you to hear very clearly, I am not at all saying that all transplants are bad. Not at all. I think you should, if you are in a position to do so, I think you should consider becoming a voluntary living donor. If there's someone in your family that could use an organ, pray about it. I mean, our health is all different. Not all of us can actually donate a kidney to someone else. But if you can, I think this is a wonderful, laudable, charitable, beautiful thing to do. If you would like to donate your tissues after you're actually dead, when you're cold, gray, and stiff and your soul has gone to be with the Lord, just tell your family. You don't have to be a registered organ donor to do that. Tell your family you want to do that, and after they're sure that they're satisfied that your death, what caused your death, they have all their questions answered, they're sure that your death was not the result of a crime, go ahead. Share your corneas with someone and let them see better. I mean, there's no problem with that. And that is something that you don't need to be a registered organ donor to do. I mean, here we have David in our midst who benefited 29 years ago and still going strong from someone who was able to do this for him. This is a wonderful thing. We should speak out against the other practices, though. I mean, my experience is people just don't know. And if they did know, they care. When you tell people about these things, of course they care. So speak out against the poor political prisoners in China and the impoverished people in Pakistan and Afghanistan. Let people know so-called brain dead organ harvesting, circulatory death organ harvesting, these people are not biologically and spiritually dead at the time of the removal of their organs, and they may not even be getting an anesthetic. So what if you need a transplant? That's something that I think, given the facts, we should all think about. I think we need to think about ahead of time what type of transplants are okay with us, because many types are ethical, right? A living donation, where both donor and recipient remain alive after the procedure. A morgue donation of a biologically dead person of tissues that can be donated. These are all wonderful, and you could accept them. You know, for myself, I could never take a heart transplant. For myself, I could not. Just in the same way as if someone, say someone murdered a wealthy person for his money, and they'd say, here's $1 million for you. I couldn't take that money. They murdered that person for the money. You know, in the same way, that heart transplant can only come from a biologically and spiritually alive person who was basically murdered by its removal. I cannot take a heart transplant. That's the decision I've come to. And that's something that, given the information, you have to draw your own conclusions and make your own decisions about. We need to be prepared during tragedy. It's good to think ahead about these things, because when the worst thing in the world happens and your loved one is there in the hospital and the transplant professionals approach you, give the gift of life, right? Make your loved one's death meaningful. I think our lives are what make our death meaningful, honestly. But be prepared, just to sweetly and lovingly say no when they ask to harvest someone who's biologically alive. And one of the big reasons we wrote the book is to offer the forgiveness of Jesus Christ to people who have been involved in this situation. Organ harvesting and transplant, this has been going on for over 50 years now. And I would be shocked if some of you in this room haven't been touched by this in some way, either as a medical professional, maybe as someone who has received an organ, not knowing that that person was biologically alive when it was taken. I've talked to people who have, given a beloved brother to be harvested, not knowing what they were putting him through. But, we make the best decisions we can at the time with limited information. And you know what? Sometimes looking back, we might regret those decisions. I am one of those people. And again, repentance and forgiveness are completely available through Christ Jesus for all. Okay, moving on. This is our website, respectforhumanlife.com. Again, this will give you all the information that you've just heard if it's been a lot, and it has been a lot. And you want to think about it, it has links to a lot of the journal articles that I highlighted for you tonight. It has the PDF of all these slides if you want to relook at some of these slides. This is our book, Harvesting Organs and Cherishing Life. It's available on Amazon for $15. We sell them at conference for $10 a copy, so if you want to pick up some now, they are a little cheaper. And again, the Harvesting Organs book has more of the stories, has more of the human part of the story. And I think that's the reason I like the book. So thank you very much.